Stella Cao is the director of the Office of Managed Care for the San Francisco Department of Public Health. And one more of our characters. Turns out that being really smart, super talented, highly effective in your work is not enough. The stresses of change, of isolation, demands of work and family spare no one. Stella Cao reminds us that fortitude requires us to take care of ourselves. Stella Cao.
If you know me, you know how nervous I am now. Where's Donna? We did this exercise yesterday, so I'm going to stop if you truly know me. So, good afternoon. To start my story today, I would like to tell you briefly about my work and myself. Yeah, here you are, Donna. I feel I'm supported now. I work for the health system of San Francisco Department of Public Health, where we serve about 120,000 members annually. And most of our patients are Medicaid patients, and a little more than half of them are non-English speakers. I've been working with the low-income population through various organizations for over 20 years. Now it's about me. I was born and grew up in a village called Silongjiang in the southern part of China. There was about 500 people living there then. This village is a part of the city of Shunde in the Guangdong province. To help some of us locate where it is an area where the ancestor of the American-born actor Bruce Lee came from. I grew up with 2 siblings, 20-plus cousins, so many I lost count of them. My family raised pigs, fish, other livestock, and grow vegetables and crops on our government-assigned farmland. Resources were scarce. I remember we used laundry soap for every cleaning job we had, including washing our hair. Now on to our health system. Our health system included an urgent care clinic shared among multiple villages nearby, and a hospital located about 3 miles away, reached by an unpaved road. Because of the lack of road infrastructure and public transportation, it would take us about 45 minutes to an hour to get there by bike. I remember my uncle biked my aunt to deliver her baby in the hospital, and a week later, he biked her back with the newborn using his bike. There were few people in my village who care about dental health. A higher priority was having enough food to eat. Just want to put that in context. As a child, I learned not to brush my teeth after having food, so then I can preserve the taste of the food in my mouth longer. Now I see many eyes, what the hell, she's standing there? How did she get here? We talk about it later. Mental health. Oh, the village. Oh. So, just give you some visual. The house you're seeing, it's my grandparents' house. And this is the street that I jump back and forth between my parents' house to my grandparents' house to keep them company at night. Okay, so this is the location, of my village. So if you know Hong Kong, where Hong Kong is, and it's about 3 hours away from Hong Kong. So it's part of the southern part of China. Okay, on to mental health. mental health was not something people understood or thought about. Of course, we didn't even have enough food to eat. My neighbor here, Tai Hong, the villagers, he often yelled in the public and talked to himself in public. He lives right behind my grandparents' house. So my neighbor told me, oh, Tai Hong just crazy. Ignore him. Stay away from him, right? So this is a brief description of the health system that I know for the first 23 years of my life. Fast forward to my first healthcare job in Los Angeles, in a community hospital in 1999. That hospital served largely Chinese and Spanish speaking Medicaid and Medicare patients. On one Sunday afternoon when I was visiting a clinic, I grabbed a coffee and returned to my car to leave. As I was getting ready, I started to sweat and my heart ramped up. My heartbeat ramped up rapidly. I felt very jittery. And I didn't know what was going on with me. I thought at that time, oh boy, the coffee is just really strong. I was in my 20s back then and feeling invincible. I was fresh off the boat, seriously, and excited about my job in a new country, getting my bills paid, making a difference in the lives of the people I feel truly connected to. I didn't bother to check in with my doctor afterwards, after that episode. What happened to me, right? What was going on with me? Between 2001 and 2012, when I was working in a Medicaid plan in San Francisco, Ellen was there. I was like many Americans in my demographic group, right? Getting married, having kids, pursuing professional job growth, going back to school, and subsequently getting a divorce. Who has time for marriage, right? But I did have time, but anyway. I left a marriage that I wanted to stay in for the sake of my 2 boys. I never thought I would get a divorce. As my marriage continued downhill, I could feel myself become more and more anxious and worried. That went on about 3 years. I remember one day when I was waiting for my older son, Russell, and that bad feeling I felt back in 2000 came back. And I was experiencing similar feeling. Plus, this time I had chest pain. And this time, though, I consulted my doctor, and she told me that, oh, it's normal for people who have panic attacks when going through traumatic event like a divorce. She prescribed for me as needed pills. And then I said, wait a second, what? I need pills? Right? I didn't know how to process the doctor's diagnosis. That reminded me Tai Hong immediately. I'm not as crazy as Tai Hong in my village. And I don't need these pills, I told myself. Of course, I didn't fill the prescription. I took it and then I buried it. Between 2013 and 2019, life seemed great. I changed job twice, and my income doubled. And I bought my first house in San Francisco and continued life with the 2 boys. We were so happy, going places, visiting families, every break we had. I felt so empowered and free as a woman. I got my life back. In terms of my mental health, I was often told that I seemed to be always busy with something or restless, and my hands shook sometimes. I had been in my job at that time about 5 years when I started to get antsy about my professional growth because I was worrying that my professional growth has plateaued. So I was wondering, what can I do to make a bigger impact in the vulnerable populations where I came from? So I started a few volunteer jobs where I can have face-to-face interactions with the communities around me, including one program where I sat with patients who have entered into the last 2 weeks of their lives. On the professional side, I was also looking for opportunities to prepare myself to be a more effective change agent in my organization. In March 2020, as we all know, COVID-19 happened. During my annual checkup in December that year, I told my doctor that I feel worried, but I don't know what I'm worrying about. Because my physical health is good, my kids are good, job are good, those I care the most are fine. So I don't know where did that come from. The doctor told me that I had generalized anxiety disorder. Many people had it, especially, she explained, especially during the pandemic. She suggested that I take daily medication, receiving therapy. I shared with my concerns about taking medication. Where's Stacy? Stacy's husband is Chinese, we were talking about that. So I told the doctor, I am Chinese. She said, so what? I said, Chinese, we do not like to take medications unless it's absolutely needed. I told her, what would be the side effects? And of course, I went on and on interrogating the doctor with a string of questions. Look, Dr. Zheng said, the medication has been tested, and people in this country has been taking it for decades. It's very safe. Okay, I nodded. And I thought about this new medication on my way home, and then decided to keep the pills in my medicine cabinet for the time being. I was even pat on my own shoulders. I said, whoa, you good job this time. You fill the prescription, If I really need the prescription, I have it this time. Good girl. To my own credit, I did sign up 2 educational classes the doctor recommended to better manage my stress, to improve my assertive communication skills. Then the New Year 2021 came. My entire team was still working remotely. I was doing great, working from home, learning to manage remote team, and then also learning to build a team culture virtually. To take care of myself, I got plenty of sleep, ate healthy food. I practiced yoga almost 7 days a week for an hour and a half a day. My boys seemed also doing really well. I was so proud of myself. I knew you can do it, see? COVID is just COVID, see? Another good job. So, in March 2021, I started losing hair. By May, I had several bald spots on my head. My doctor referred me to a dermatologist for treatment of hair loss. Of course, I received a series of steroid shots on my scalp, a few months, I think. And then I began taking pills to promote hair growth and boost my overall immune system. My hair used to be almost down to my waist. Between March and August that year, I lost 70% of my hair. That was terrifying. My sons, my families, they were really worried that I have other disease causing this. Luckily, all test results come back negative. Oh yes, this time I know I need to better manage my stress. Using the techniques I've learned from all these classes, and I started journaling, practicing gratitude, writing things that I appreciate about others and myself. In November 2021, I felt I have everything going for me, including having a job that I am so passionate about, receiving a full scholarship to CEF6, right, for the class of 2022, which I was so eager to be part of, having a loving family, and moving into my dream home. Nevertheless, giving all that, one Sunday afternoon in my brand new living room, I began crying uncontrollably. as I was writing my gratitude notes. I told my partner that I never felt so bad before. Because I cannot stop worrying, and I cannot get out of my own trap of negative thoughts, as if somebody always trying to come and get me. And I told him that I'm sick. I need to see a doctor. So I scheduled an urgent appointment for the next day. From there, I started a series of treatment for anxiety. And this time, finally, I realized how bad my anxiety had become. And I was absolutely committed to the treatment that my doctor recommended, including weekly therapy, daily medication, and medication monitoring through a psychiatrist. After all, I love life, and I love what I do, and I wanted to feel better. When I started the CF6 fellowship in January 2022, and I was doing some self-reflection, I finally realized how silly I was. I have been in healthcare for more than 20 years, yet I let my own culture, my Chinese culture, distort my perspective towards my own mental health. I was so stubborn, even after losing my hair. I was not convinced that I needed help. Yes, while my inner circle was fine, I still carry inside me childhood traumas caused by food insecurity, gender inequality, favoritism based on skin color, and I wasn't the favorite one, of course, because I have darker skin, that I need to deal with. And I was also under stress from COVID protocols, Black Lives Matters, anti-Asian hates, climate change, wildfire in California, and that turned the blue sky to orange from morning till night. All of this and more was leading to my mental breakdown at the end of 2021. Since then, I've been taking medication, receiving treatments for my anxiety. I've been feeling the strongest person ever. And what have changed me in these few months? Now I have been had the courage and confidence to have very difficult conversations in my organization to advocate and drive changes that are bringing in millions of dollars to our health system to help improve the financial sustainability of our Medicaid program. I have also facilitated changes of city programs that help reduce the dependencies on general fund by millions of dollars. And Doug is going to love this. I've started to mentor other women across the city system. And I couldn't help wondering how many more people like me are out there. I'm looking at you now. Who had childhood trauma, are Asian, immigrants, parents, healthcare leaders, or just women who are going through menopause or having mood swing, and who choose not to take care of our own mental health. To close my story, I would like to share 3 things that I have learned. First, recognizing my mental health is as important as my physical health was the first step I took towards my recovery. Secondly, is exercising self-compassion. I'm doing a lot at work, at home. In my culture, it is selfish to take care of ourselves, but it is not. I keep telling myself, it is not. It is smart to take the time to take care of ourselves. Lastly, don't wait to get help. I will prioritize my time and resources, including my income, to allow myself to get help, to improve both career and personal well-beings. I really don't need more than 20 pair of shoes, right? And multiple set of suits, so I cut all this out. Including hiring an executive coach, seeing a therapist, visiting a massage therapist, acupuncturist, chiropractor as needed. And I've hired a housekeeper. So it does take a village. So thank you so much for listening to my story, Stella's story. And please take great care of yourself. I love you.